I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel.
Hello, I'm Lindsay Hall, and welcome to the Plastic Surgery Channel. I'm here with Dr. Steve Teitelbaum to discuss some innovative technologies taking place in plastic surgery today. Dr. Teitelbaum has a practice in Santa Monica, California. Dr. Teitelbaum, thanks for joining us.
I'm happy to be here, Lindsay.
We're glad to have you. What can you tell us about your practice?
I'm in practice in Santa Monica, California. I specialize in cosmetic surgery, so I do facial rejuvenation, I do breast surgery and tummy tucks, post-weight loss surgery, the whole spectrum of cosmetic surgery.
Fantastic. What led you into the specialty?
I knew I always wanted to be a doctor, and I knew I always wanted to be a surgeon. And I remember one day in general surgery where they did a mastectomy, and then the plastic surgeons came in the room and did a breast reconstruction. And I thought to myself, would you rather remove things or make things? And I realized I want to be a plastic surgeon. I want to make pretty things.
Fantastic. All right, well, let's get into this. You are part of Axis 3D Imaging, is that correct?
I had one of the first Axis 3D imaging things in my office.
Okay, and why is 3D imaging of interest in plastic surgery? What are the benefits?
Well, 3D imaging is very exciting to me and is very important to plastic surgeons. When you think about it, we try to pretend or call ourselves sculptors. We do work in 3D. So asking why 3D is important to us for imaging is like saying, well, why did Michelangelo one day work in marble and one day work on a canvas? When things are in 3D, it makes it much more able for us to evaluate what we want to do. We can document the way somebody looks. We can look at asymmetries and notice nuances of form and structure, which the eye doesn't notice looking at a 2D image. And most importantly, with Axis 3, not only does it document both before and after surgery in 3D, but you can do simulations on the preoperative image so that you can see in 3 dimensions what type of result a breast augmentation might create.
Now that's impressive. Now 3D imaging in general has been around for a decade or so. What makes 3D imaging today different from post years?
It's a lot. 3D imaging has progressed like everything else with computers in the last 10 years. 10 years ago there were digital cameras, but compare the digital camera you had 10 years ago to what you have now. Your cell phone is better than then. So we have greater resolution, much faster image processing at an affordable price, and the ability to do morphing, which was never possible before just due to advances in programming skills.
Now you did mention a better price, which of course hits everybody's bottom line. What actually is the price differentiation from prior years to current? Or what would it look like now if someone wanted to do that?
I think that no plastic surgeon had 3D imaging except for somebody specifically involved in researching it as a hobby 10 years ago. The price was too stratospheric to even consider. But I was aware of systems selling for over $100,000 a few years ago, and now the Axis 3 system is in the $40,000 to $50,000 range. So the point is, at less money, you're getting much better than was ever available before.
And it gives it better accessibility to more people and more patients on the whole.
That's right, because more plastic surgeons are going to be able to afford it, more patients will be able to have the benefit of going to a plastic surgeon's office, seeing for themselves their breasts in 3 dimensions, and seeing how surgery might change the way they look.
Now, seeing for themselves and looking towards, what am I going to look like after this is done? Is that really true? Can you really do that? Do you feel like you can give a patient a pretty good idea of what it's going to be afterwards?
It's interesting. Sometimes you do the simulation, and as a surgeon that's already done thousands of these operations, I can look at the image and know that that's pretty much in the ballpark of what the patient will look like. For other breast types, it doesn't quite look right. And for reasons we don't yet understand, the simulation doesn't look as good. So the answer is yes, sometimes it gives a very honest and realistic simulation, and other times it doesn't.
Okay. What do you see the future as being for this technology?
I think the future for the technology of 3D imaging is that at an even lower price, and at an even higher resolution, and at an even higher quickness and speed, it will capture beautiful images. It will enable us to produce simulations of surgery with even a higher degree of predictability. The engineers right now, for instance, at Axis 3, are creating physics models where they look at the stretch of skin and they try to understand where the existing breast tissue is. And then it looks at what type of breast implant they're putting in, and where the implant will be in the breast and how that will push out the tissue and stretch out the tissue. So I think we're going to get to the point where we're going to see very accurate simulations soon in the future.
Dr. Teitelbaum, thank you very much for joining us. Don't forget, you can Twitter us your questions to be answered by future guests. And we here at the Plastic Surgery Channel thank you, the viewer, for watching.